Thank you so much, Empire. We really appreciate everyone's time for coming here today to learn, to be educated, to share your questions. Today, we are very excited to have with us Tatiana. I feel like many people know you in this community, but I know there's a lot of people outside of this community that are also joining today. And so we really appreciate your time because you're going to tell us the world of Plexr and really, beyond Plexr, just about your practice. And we're all here to learn about active acne and how you can treat that, which is sort of a hard thing to treat in this environment. And of course, the CEO and founder of MedResults, Arash Kalantari. How you doing, Arash? Yeah.
Hello, everyone. I am doing well, thank you. And I'm also so excited to talk about acne and know more about Tatiana's basically experiences with Plexr. We had a long journey together, which we're going to talk about that. Tatiana.
Yes, hi. Good evening, everyone. Thank you for joining us. So those that doesn't know me, I'm Tatiana Sarmiento. I'm a nurse practitioner and board certified in aesthetics, and I work for Empire Medical Training a few years now. I start my career in aesthetic with Empire. I had grown as a professional, as a educated at the same time. So, and it's a pleasure for me to be here with you guys, sharing all my experience that I have, my short experience that I have with this device. I wish we had it here in the States before the time, but I say the right time is always now.
So today we're going to basically choose a different approach. We're going to talk about active acne. We're going to talk about how can you treat them without using all those basically heavy duty medicines, antibiotics and all of that. And also we're going to talk about the technology of Plexr. But more than that, we're going to talk about Tatiana's experience and her journey about Plexr. So I want to ask you, Tatiana, a little bit about yourself. As Jeffrey said, many people, they know you, but maybe they don't know you that deep. So if you want to tell your story a little bit, how you get into aesthetic and your things that were difficult, challenges that you overcome, and all of that, and then we move from there.
Awesome. Okay, thank you so much. This is a wonderful opportunity. Well, I'm original from Venezuela. Back in Venezuela, we are exposed to aesthetics since we start our career. When I moved here, I start my path again to become a nurse practitioner. So, and then in aesthetic work. So I'm in love with aesthetic work since the beginning, and I always passionate about it. So doing injectables like Botox, fillers, threads, all these different kind of procedures that you can do that no semi-invasive, no invasive like surgery. It helps to keep and to prolongate, longevity in patients. However, I always felt that I have like a roof over my head treating certain condition. For example, one of them and one of them, and the most important, and what it made me get my eyes, my ears, all my sense into Plexr was hooded lids. So back in Venezuela, I used to be with ophthalmologists, oculoplastic ophthalmology. So I was be seeing a lot of blepharoplastic. So, and I was like, you know what? If you have your eyes covering half of your pupil, you need to have surgery. I will refer to ophthalmology, plastic ophthalmology that is in this area, and I will refer all my patients. So I was feeling that I couldn't help my patient more in this area. So that was what it just caught my attention when Dr. Arash said to me, Tati, this can help you. And I said, really? So I put my eyes on it. I start my investigation. So voila, I have great results with my patient. So I still learning, okay, the technology, especially in this area in Florida, South Florida, that I have a lot of Fitzpatrick 3, 4, 2 mix. I see a lot of Hispanic population, so all of them are mixed. So, but for my surprise, Plexr is more than that. It's more than soft surgery for the eyelids. I find out myself that people that had acne, I was doing Plexr shower, and all of a sudden the acne was getting better and dry. I could have just go with the little, and I say, let me just go back to the videos because we get the technology and we don't read the manual, right? I'm pretty sure
Unfortunately.
a lot of you are with me. So, and then start watching the videos, and I was like, yes, okay, let me try. Let me follow these protocols. And then I have come out with some of my own because this is the versatility that this machine has given to me, that I can, use my knowledge and try to adjust it to my need as a aesthetic injector. However, I do have a background in dermatology. I was for a year working with a dermatology, so I do treat a lot of lesions in the skin and in skin problems with my patient. However, I'm not in a dermatology practice. So, and that helped me to do not refer my patient as much as before.
Yeah, you can handle it yourself.
Yes, yes, definitely, definitely.
So you
So,
want to show some of the next slides?
yes, definitely. How much do I like the result for making, using Plexr? I'm gonna show you some results. This is a before and after. In this patient, in the left side, you see the before and then you see the after. Okay. So the complexion of the skin, and then actually, let me just pass. If you look at the eyes, look at the hoodie eyes, closed eye, and then look at the eyes look more open. That was just one session of soft surgery, and I did cat scratch as well in this patient. So then in this beautiful patient, I did Plexr shower and the rock star. And then in the marionette lines, I did cat resurfacing.
Yeah, it's very obvious. This manual
Yes.
improvement.
So then another time, because you have to do several sessions in this patient before you say it's minimum 3 sessions of soft surgery. So you can see
Max
her
3
neck.
seconds.
Well, fine now. Okay, I still into it. And I get this result. Look at that.
Yeah.
Um, and this was a lady that lost a lot of weight and
Hmm.
was complaining of laxity under the neck. She was not complaining about her lips. She was not complaining about her nasolabial fold or marionette line, just the neck. So I treat the neck. That was this third time that I did Plexr soft surgery in the neck. Okay. But I mentioned to her, I'm already here doing your procedures. Why we don't treat your nasolabial fold and your marionette lines with cat resurfacing? Because she didn't want the downtime from the neck. However, it's the same time, like you're gonna be 10 days, maybe 4 days without with social downtime because you don't want people to see the mark. However, she went to work. That was Friday for the soft surgery, Saturday, Sunday, and Monday she was working. So here it is, another picture from far. And you can also notice the Plexr shower that I did under her eye. It helped with the puffiness. So that's what I do, combination therapy. And that's what I'm in love with my Plexr, because I can do different treatments in different areas and get
This
excellent,
guy is amazing.
yeah, excellent result. So you asked me, is a Plexr a good choice to start or expand? Maybe both. Plexr can be both. A good choice to start and expand a dermatology or aesthetic medicine. So it can be in both. And if you want to combine both, that I think is the way to go. It is Plexr offer a versatility and non-invasive solutions for treating variety skin complexion, skin concerns, active acne, scarred in acne. I think the precision of the plasma application and minimal downtime, make it appealing to patients who maybe hesitates to try more aggressive or invasive procedures. So it hasn't, it's not too complicated for me to convince a patient to try Plexr. And that's one of the things. The consultation here is vital, but we are in time matters. More patients that we see, more income that we have. So I'm trying to show my consultations as much as I can. And the explanation of this, it actually helped me. And actually today I asked Arash to please send me one of the big
Banners.
banners with all the little pictures because over there is everything. So you put together all those pictures that really help me. So going back to the plasma application, effectively reduce acne. That is by targeting sebaceous glands and helping remodeling collagen. So that's why in the dermatology area towards to acne, it has helped me a lot to improve my patients' acne concern. So in here, I want to mention also, let me see, the system is not going. Okay. And the impact that I have done in my practice, well, I mentioned to you guys that it has improved my time in the consultation because some of them just want to jump on it as long as
There you go. I brought this back for you. So
oh, look at that.
what we're talking
Yeah,
about.
that one. I need it. I need it on my front desk.
Yeah. So basically, we made this before and after banner, which you can put it in your practice. And when people come to visit you, they will come across for one of the indications that they have problem with. For example, if somebody has keloid and they see this keloid here, they say, oh, I didn't know if you do that. So I want that. Or for the moles, or for the nose contouring, or milia, or rosacea, all of that. So that's what Tatiana was talking about.
Exactly. So it's a precise plasma. It target and the treatment resulting in improved outcome. So the ability to reduce oil in the patient's skin is tremendous. And actually, in the beginning, when I was doing Plexr shower in some of the patient, I noticed is that I have to emphasize the use of good hydration. Okay, so in the case of acne, is something that works on my favor because that is what I'm looking for. Reduce excess oil production, treat active acne, and promote collagen that I mentioned it to you as well. So offering Plexr treatment can distinguish your practice from others field, and it does. I'm getting patients referred by other injectors and other providers to my clinic since I have Plexr. Oh, Tati, you have it. Okay, I'm gonna send you this patient. Oh, colleagues, Tati, you have Plexr. I'm gonna go and visit you to get it done before I buy it. Just I want to try it, and I say, yeah, go ahead and do it. So integrating this in your practice is going to contribute to patient retention, referral, and overall your practice growth. That is a fact. So and I appreciate Dr. Arash to push me in the beginning. I was like accepting, and he's like, Tati, believe me, you will see it have a tons. And another thing that I have to add to you though, maybe I haven't had time to talk to you about this, but in the area of the eyelids, so it's tight, beautiful. And I'm a little more advanced to treating this area because my background from Venezuela in ophthalmology area. So I do know the anatomy, I do know how it works. And then when I came here, before I became a nurse, I was ophthalmology technician. So I work with well-known ophthalmologists here and retinal specialists in Florida. So I'm pretty much felt comfortable using this technology. You were talking about scars, and actually, if you in the aesthetic, when we do threads, you can get in a thread that it was dislocated, like the smooth thread when they comes out. And I had a patient. So this patient didn't want to pull up the threads. It's way too long to remove it. So I make her come, and it was a little abscess. So I open it up with Plexr. And I remove all the pus that it was there, and then I try the lesion with Plexr catheter surfacing all on top, and it was amazing. I have those pictures on my phone. I don't have it here. And 3 days later, the patient, no scalp, a little hypopigmentation, and then natural in 2 weeks, she's like, I don't have anything. So you can also treat another conditions or
Yeah.
complications that you have in your practice. So
Yeah. So basically, thank you for your points. They're all really practical points that help people to, to know more about it, about Plexr. One of the things which is why we have lots of Plexr installed in Florida is that in Florida you have basically high amount of sun, and also you have diverse population of different colors. So most of the time, like lasers, they are very restricted when it comes to this kind of environments, and that's why. And I know how painful it is after all the marketing and investment that you have done, and then you get a client who is willing to pay, money and get some treatment, and you can say, unfortunately, I cannot do anything about you because you have darker skin color, and then the laser doesn't work. Or, for example, it's summertime and you have to wait until winter, to work. So Plexr doesn't have any of those limitations, and it's a good choice. When we talk about a scar management, I have some slides that I show you guys later on. Okay, so go ahead, Tatiana.
okay, so I would like to take the opportunity to dive into more talking about what we're here today is about acne, the types, causes of acne, and acne scar, and challenges they present in the treatment. So if you say, well, maybe it's just some acne that I can treat with Plexr. Well, I can tell you that all kind of types of acne that you can treat it. However, as everything in practice, you need to use a combination therapy. This is one of the tools in your toolbox that you are going to pull out at the correct time to use it in your patient. So if you have a patient, for example, including blackheads, whiteheads, papilla, pustula, nodules, cysts, is typically caused by combination factors. It's not just oil production. It can be clogged pores, bacteria, hormones, and inflammatory process. So I use Plexr, yes, but I do have an excellent esthetician that I work with me. So she helped me to cleanse the skin, prepare the skin, keep the patient hydrated. We use light therapy as well. So then I go into a little more of my background in dermatology, where I try to find the cause of the acne. So it can be hormonal changes. We see a lot of young people that are in poverty, 15, 14 years old, okay, that they don't want to look, and they are worried about how they look. So, and this is one of the tools that I also have helped me to get into other population that it was not in my mind to treat, okay, as an aesthetic nurse. Why? Because you think that you're just going to treat 40 years old or 30 years old. Oh, well, now young people just for the lips. But no, I'm treating 13, 14 years old kids that comes with their parents to treat the acne. So, and having all this tool, having an esthetician to help me to every month keep them clean, the skincare all combined is what is going to help you. Nothing by itself, it will help to treat your patient with acne. Because it's so challenging treating acne. And then you have another thing to treat, that is acne scars. So including the right combination of treatment to each individual skin type and severity of acne, managing potential side effects that Arash just mentioned about um, um, skin darkness, dark skin, or mixed skin that can just pigment it, can be hyperpigmentation and hypopigmentation. So in this case, it helped me to feel more safe treating this patient. However, we have to understand there is a hyperpigmentation caused by inflammation. However, even doing a little extraction, you create an inflammation in that patient. So you have to treat those patients consequently that week with topical cream, okay, with some acid after. Sometimes you can just have to give them light therapy. So is my point here is that yes, you will have some that I call no complications, side effects, but they are so well controlled after. In the beginning, as anything that you incorporate in your practice that you don't know how to work, you get a little anxious when the patient call you 2 weeks later and say, oh my God, I have a little pigmentation here. So now I say, no, I don't even let that happen because I already know and I really educate them that in a week later, you have to start using your acid. Okay. So just to clear one a little bit, that hyperpigmentation due to inflammation, and that's exposed inflammation. So you get it even when you pop up by yourself, you acne. Please don't do it and teach your patients to not do it. That's
So
pretty much my point in the acne area. Okay, so you want to add something, doctor?
can I add something? Yeah.
Yeah.
So as Tatiana was talking about, so when it comes to acne, there is a very complex situation because you usually have active acne and acne scar. So most of the time when you want to approach acne scar, you have to basically wait until you don't have any active acne in most of the technologies. So with Plexr, you can treat acne, active acne with acne scar at the same time, same day, by different basically modality and different methodology. So it's one of the unique things about basically acne treatment, which Plexr can provide at the same time. The other thing is, um, so when it comes to acne, again, you have all kind of a skin and you have all kind of Fitzpatrick. And then also there's different anatomy. For example, there are people who are suffering from acne in their back and chest. So usually when it comes to back and checks, then the use of, for example, laser devices are very limited or contraindicated. So you can use Plexr on every anatomy of your body with no limitation, no restrictions. And now, the way that Plexr approached acne is a little bit different. We target, first of all, with Plexr, you are shrinking the vessels and inflammations that happens around the acne. Also, plasma basically sterilizes the tissue. So it kills all the germs and bacteria which are causing inflammation in a cystic and comedogenic acne, basically. From the other side, you are opening the acne. So you are basically releasing everything which was accumulated there. So you are sterilizing it, you are draining it, and you are basically treating the active acne. Now, when it comes to the modality that you use, as Tatiana said, we have 3 different modalities. Do you have more slides here, Tatiana?
I have my patient.
Okay, let's just show your patient, and then I
You want
will
to?
take you
Yes.
to the other slide. Yes.
You know, you were commenting about the different stage of the acne. So we have a beautiful patient here that she have this active acne. She has a scar, and then she have the comedones. So this was the before. Of course, we did a deep cleaning. We did dermabrasion, we did hydrofacials. She is in a skincare regimen at home. And then she came and I did one session, okay, of my protocol where I use the Plexr soft surgery to treat the active acne right at the lesion. Then, and the other, you're gonna see that I did a little scratch technique in one of the acne that was very, very elevated. And then Plexr shower to try to control the oil on her face. So, and this is actually 3 days after Plexr. Here we have, yes. So you still see the scalp. And today I called the patient because I wanted to follow up with her. Today is the 5th day since I did the treatment. And she said that all the scalps has fallen. So, and actually she didn't have any social downtime. So I want to show you the video. So in the video you can see, okay, all the active acne and combination. I do apply BLT cream with all my patients that are going to treat with soft surgery. I love to use new glycerin oil for actually, some of the patients were a little worried, saying, Tatiana, this is too oil. I cannot have that kind of glycerin. Excellent with that. So here you can visualize how I'm using the soft surgery right in each of the spots. Okay, she has a lot of scar starting from.
Tatiana, let's watch the video because it has voiceover, then you talk.
Okay.
Yeah, you can move to the next slide, I guess.
Okay, so I'm very satisfied with the result as well, the patient. So you can add your slide, Arash.
Okay, so if you stop sharing your screen, then I can.
Okay, so I will stop my sharing.
Thank you. Perfect. Okay, so now one of the things that we talked about is the different modalities. You frequently use the term Plexr shower, and I want to explain what is Plexr shower for our audience. And also the CAD resurfacing you use, which is our fractional Plexr semi-ablative, and also the soft surgery technique. So I'm going to go over these techniques very quick. So then everybody knows what are we talking about. It is very important in basically medical technology, in aesthetic medical technology. It's very important to have access to all 3 different modalities, because you cannot just treat everyone with, for example, ablative, or you can't use non-ablative for everything. And that's why you usually have to buy 3, 4 devices to have all 3 modalities. So with Plexr, we have 3 handpieces and we have 3 different modalities all in one device. Now, Plexr shower or nano-ablative plasma is the name that we have for the non-ablative, basically, technology. Lots of rock stars like Paula Abdul, Kardashians, they're using this technique because it gives them immediate lifting with no downtime. And Tatiana can tell you about basically how fast and quick you can see basically the lifting effect on your skin. So this part of the technology uses a triangle tip, as you see here, and it causes some micro, basically channels and micro traumas in your skin. And through that, you have immediate lifting, and also you have some channels open that you can use it to feed your skin and then to send needed and required active ingredients into your skin, like, for example, active bars or active fuel. So this is one example of the result after one session of Plexr shower, which we call glass lift protocol. In glass lift protocol, we mix Acto Reverse and Botox, and we use them as a topical after half an hour of Plexr shower treatment. And you see the skin texture. Also, you can see it was basically effective on acne scars here. So you can use Plexr shower for active acne, acne-prone skin, especially in younger generations. I have my wife's nieces. They come from London like once a year. They are right now they're 19 and 17, but when they started their active acne, they were like 13 and 15, I guess, 2 sisters, and they spend like a month every year with us in Los Angeles. So I put them on Plexr anti-acne treatment. So like every year they are here for 1 month, and then I have given them the treatment for like 2 times, and they are okay for rest of the year. So with like 2 times 2 sessions of Plexr treatments every year, they were able to basically pass these years of active acne, and they are basically pretty good. Now, the second modality is semi-ablative Plexr, which is famous as cat resurfacing or fractional Plexr. With fractional Plexr, your goal is to shrink the skin, to activate collagen synthesis, and basically take care of saggy skin, wrinkles, and stretch marks, acne scars. The difference between fractional Plexr and fractional laser is that in fractional laser, you make spots, you make dots in your skin. In fractional Plexr, you make lines. So lines compared to dots, as you see, it covers more. And because of that, it's more effective. Now, because Plexr does not or has the lowest thermal damage, the healing process after Plexr is very quick. And that's why Tatiana was explaining, like 3 days, 4 days after treatment, the client calls and they have basically, they heal the skin and nothing left that much. So this is right after treatment. This is day 1, and then this is day 3. So in 3 days, all those scabs are gone, and then 1 week after treatment, the skin gets back to normal. And that's how you use Plexr for semi-ablative. You use the bend the tip, and then you go over the skin. You glide it over the skin, gently touching the skin. And then you can go over the upper eyelid, lower eyelid. No, basically, limitations here. You can work on neck lift and neck lines. These are some of the examples of CAD resurfacing technique. Like you can treat genital aging, hand aging, neck, underarm, hair restoration, décolleté, breast, and all of that. So I want to focus more on acne here. So these are some of the scar management that Tatiana was talking about. So you can work on keloids and the scars. Now we start working on basically acne scars. So as you see here, you have some active acne here. And also we have acne scar. So the combination of active acne and acne scar here. And this is after, I think, 2 sessions here. The other case that I have, this is 2 months after 1 session. And as you see here, look at the improvement. And for this one, we used the combination of plexroplasty and CAD resurfacing technique. So we worked on acne scar and active acne at the same time. This is also cystic acne, cystic active acne. Okay. So we have some questions, Tatiana. How
Well, I field some of those, and you guys could tell me which ones you like. How often can treatments be repeated in the same area until the patient gets desired results in the problem area? And what is the time frame to wait to retreat the same area for those results? That's from Stephanie.
So the answer is it depends on what kind of treatment you are doing, but basically most of the treatment with Plexr is between 1 to 3 sessions. And the interval time between them is between 1 to 2 months. When it comes to scars, keloid, mole, pigmentation, skin tag, this kind of stuff, most of the time, it's just 1 session.
What about acne specifically? Another question is, how often do you do Plexr showers for acne clients? And is there home care after the treatment?
So for acne-prone skin and active acne, if you want to use Plexr shower, you have to repeat that quite minimum 3 times, because acne is something that can happen again because of your, the lots of etiology for that. So we cannot limit the numbers when it comes to acne-prone skin. But after the first session, the skin starts to cool down. Really, it chills very quick. And then maybe you do it first, and then after 2-3 weeks, you do the second session. For the third session, you might wait until it comes back. Sometimes it is 3 months, sometimes it's 4 months, sometimes 6 months. And then, as I explained about my nieces from London, you might do it every 6 months, every year, to keep it basically the way it is. And yeah.
Cool.
Yeah,
Anything
I
to
would like
add,
to add.
Tatiana? Yeah.
Yes, please. Thank you. So definitely this is a condition that unfortunately is tough to cure. Like if that question is like, maybe I get treatment of acne with Plexr and that's it, no more acne to come. Well, unfortunately no, because the environmental, the hormones imbalance, nutrition aspect is something that we cannot control. So definitely is a month. I do it in my patient every month, and when they get a flare up, I may do it more frequently, 2 to 3 times, with 4 or 3 weeks in between. And however, with the soft surgery, I do sometimes in one session, I don't treat all the acne. And I have patients with high scar, like big areas with scarring. So I divide it in 2 to 3 sessions, and they know that this is a continuous treatment. It's not just one-time treatment. However, I will say, and some comedones or some scar tissues from acne that I treat, I haven't seen them come back in that same area, in maybe in another spot. And especially in the neck and in the back, So it's when I get recurrence. But in the face, if we keep it under control with home care. So when we say home care is this patient needs to have a good cleanser regimen, okay? You need to put the patient at least in salicylic acid, okay? Get a good protocol for acne. But this is very specific for you patient. Not all the acne treatment will work for all of them. So you have different age, you have different kind of acne, type of acne. So you need to do a good assessment, come out with a good diagnosis, and then your plan, it will be set to that patient in a specific. So in the patient, as an example, the patient, that young patient that you see, as I mentioned, we do hydrofacials on her constantly. She take care of well and a home care treatment. She's very proactive with her food, and I do have some treatment done to her with chemical peels. So it's all these different kind of treatment that you can combine and give it to the patient. But I do not offer this as a fit for the acne, because I don't think so. Even the dermatologists with more advanced treatments or with medication like Accutane promise their patients to cure acne.
Yeah, and then also when you talked about Accutane. So if somebody's on Accutane and you want to move them to Plexr, you have to stop using Accutane at least 3 weeks before. Then you can start using your Plexr. And I promise you, after Plexr, you don't need to ever get back to Accutane. It solves the problem.
Yeah, that's related to the question about what products to use for hyperpigmentation after a procedure.
So first of all, hyperpigmentation is not common after procedure. You know, the risk of hyperpigmentation after Plexr, based on our clinical studies, is less than 2%. Now, there is PIH and there is redness. So I want to differentiate those two. PIH, which is post-inflammatory hyperpigmentation, happens after inflammation is gone. Now, sometimes, like 10 days after procedure, people might call you and say, hey, I have pigmentation. But if you really look at it, it's not pigmentation, it's still redness. So when your skin is red, which sometimes that redness will be basically mixed with pigmentation, you don't need to do anything. You don't need to do any kind of treatment. It will be fine because it's a healing process, it's a natural healing process, and it goes well by itself. We don't have any permanent pigmentation after Plexr so far. So if something happened, like 2 months after Plexr, if somebody had PIH and you don't do any kind of treatment, it will go away in less than 6 months. Now, if that happens to someone and you want to cure it earlier and faster, of course, you do some basically like anti-pigmentation, some exfoliation, glycolic acid or things of this basically type, like alpha-arbutin, tranexamic acid, and this kind of stuff. But overall, it is not a problem that I'm worried about. I have over 900 Plexrs under my umbrella. I don't receive phone calls, hey, Arash, I have pigmentation, help me with that. Maybe every 6 months once. Tatiana, if you want.
Tatiana, anything to add?
Yes, definitely. So I'm not as lucky as you. And I think my patient, what happened with my patient is I'm very proactive with them, and as soon they get something like off, like a little pigmentation, because my patient has melasma. So it's just, even when they do a strong hydrofacial, or they go to the sun, or they go to work out, it exacerbated, like, because because the heat is not per se for the treatment, but it can be another thing. So, and I do listen to them, and I bring them, and I try to keep them under my umbrella, under control. So that's why I add in my protocols 2 weeks later to give them light therapy, because I do have patients that I had pigmentation, especially in the area of the lamellar when I do the soft surgery. But I say, and it's true, it goes away within 3 months, 4 months, it goes away by itself. You can't leave it alone. But these girls are very high maintenance. They don't want to have this on. So I do an extra step on them. But and I mentioned that it that goes away by itself is because in December, okay, I have the Plexr shower with botulinum toxin, okay, and the Plexr glass. Love it. However, in January, I feel like my pigmentation was a little um irritated. I was a little more things, and I got a little afraid. I was like, oh, I'm gonna do color rash. I didn't have time to call him. I didn't have time to look at myself, too much work, 2 kids, okay? So Empire Medical Training, the practice. And to be honest with you, I didn't do anything and look at my face. I do have a little makeup, but I don't have that pigmentation.
Yeah, so one of the things that I want to emphasize about pigmentation, Tatiana, I know that people freak out.
Yeah.
Know, both practitioners and patients, they both freak out because pigmentation is something that basically made us to develop Plexr, because we were manufacturing laser before. So we were looking for a solution for pigmentation when we developed Plexr. Now, we need to know when it comes to pigmentation, pigmentation is a defense reaction of our melanocytes against stimulation, So one of the strategy when it comes to pigmentation is just to calm down the skin. And basically, the most recent and new methodology and protocols against pigmentation are less aggressive. So before you might use TCA, or things like that, but now you're trying to more use things like tranexamic acid, alpha-arbutin, which they're not aggressive at all. They're just calming the skin, and that's how you help with the pigmentation. So my personal strategy is when it comes to pigmentation, try to be mindful of anything that can cause any stimulation, because our body is a very intelligent machine, and it knows how to handle itself. Sometimes we just need to a little bit be patient and let it to do what it needs to do. So that has a better, basically, long-term outcome. But of course, we can do some basic preventative treatment or anything like to have faster results,
Super cool. A couple other questions. Well, one, it's an FDA cleared device. It does come with the three hand pieces of the workstation. For anything around pricing, we have a few different options, especially with financing. So just take your camera and look at this little QR code, and you could book a meeting, and we could talk a little bit further about your practice and your needs. And I'll also put the link to the Calendly in the chat box. We talked about this a little bit, but we can use this on active acne, correct, Tatiana?
We can.
Yes.
Yeah.
Yeah, we can.
Awesome.
Yeah. So
And
there's a question here,
yeah.
Jeffrey. I see somebody ask about a big scar, like 14 by 14 centimeters of scar. What's your recommendation treatment technique? So when it comes to scar management, Plexr basically is the hero. So you have plexiplasty technique, which is the ablative technique for this kind of hypertrophic scars, no matter what is the reason, if it's from burning, it's from surgery, or from things like that. Now, the methodology, it is the combination of a spot technique and a spray technique. So the first action is you cover the whole scar using a spot technique. And then between your spot, there are some edge. Then then you use your spray technique and you remove those edges basically, and you make it resurface. That's how usually you treat a hypertrophic scar in about 2 sessions. When you get expert, you can do it either in 1 session, but I like to be more gentle to skin and do it in 2 sessions instead of 1 session.
Awesome. And what local anesthesia do you use?
Numbing cream, which is 23% lidocaine, 7% tetracaine.
Cool. A few people asked for posters. I posted my email in the chat. The posters became a hot topic today because of the conversation between you two.
And the first in line, please.
Okay, you're number one. A few more questions. Let's see. We talked a lot about hyperpigmentation. Let's
I
see.
saw a hypopigmentation, one of them. I
Hmm.
had the patient that I show in my presentation, the young lady with the neck. She presents some hypopigmentation in the neck, and in about 3 weeks, it was completely gone without doing anything.
Yeah, we don't have any
She was using the vitamin C balm, a hyaluronic acid, and sunscreen. That's
Yeah.
all.
Even though in Fitzpatrick 5 and 6, when you remove some scars, we have pictures of it, which the first 2-3 weeks after procedure, you see some hypopigmentation. Basically, that is a different hypopigmentation that happens after laser. So after CO2 laser, you have some sort of hypopigmentation that starts happening few months after, and it is permanent hypopigmentation. But this is more like an inflammation, and then it goes away as you said. There is another.
So I have a question.
Yes.
Somebody in my Instagram
Okay.
just asked me,
Nice.
they
Nice.
didn't get into the webinar. Do we record this webinar and somehow post it in YouTube or in Pi Medical
Of
website?
course. Yes, absolutely. So we'll be this webinar is being recorded. We
Okay.
have a Vimeo page with all of the previous webinars and Q&A sessions. I will also post that. Everyone who's registered to this will get an email from Med Results in the coming day or so with the video and any answers to questions we didn't cover. Let's see. Arash, you saw a couple of questions that you'd like to hit up?
Yes. So does this technology can treat pregnancy, face hyperpigmentation marks, which we call it melasma most of the time? The answer is yes. So when it comes to hyperpigmentation treatment with Plexr, we have a variety of methodology and treatments. Number one is basically the nanoablative modality. So for melasma and pigmentations after pregnancy, the best way to treat them, because they are deep. So when they are deep, you cannot use basically ablative techniques to remove them, because then you end up causing some scarring. So the best way to treat them is to use Plexr shower, which opens the skin, activates the skin. Through those nanochannels, you can basically send your. We have a serum for pigmentation and melasma, which contains alpha-arbutin and tranexamic acid, also glutathione. So you apply that as a topical mask. It penetrates deep in your skin. It's interesting because from the first session, you see improvements, and that improvement is very visible. Now, when you repeat this treatment about between 3 to 4 or 5 times, you get more than 70 to 80% basically result. Basically, the pigmentation dissolves and you don't fades away and you don't see it that much. So that's one way. Now, the second way to remove pigmentations, if the pigmentations are like, for example, hyperkeratosis, then you can use your ablative technique and remove it all in one session. What method are you
Excellent.
using for acne,
Excellent.
scarring, and keloid? So for acne, scarring, and keloid, we have a very specific technique. So actually, this is one of the most unique and interesting part about Plexr, because when we want to treat acne scarring and keloid, first we scan the whole area, and we want to use kind of like a magnifier, because you have to use your handpiece in a different way when it comes to the heels compared to the canyon of the area. So we use cat resurfacing technique or plexroplasty technique in this procedure. Sometimes we have to remove the normal skin, which is between two atrophic scar, to make it even. So the whole strategy here is to resurface the skin, and that happens with the true understanding of basically hills and canyons. And inside the scars, we don't want to use any of ablative techniques. We want to use, because it's already deep, so you don't want to ablate it and make it deeper. So the only technique that you use inside the scar is CAD resurfacing, which activates collagen formation, and it raises the scar. And then when you get your device, you get full training on all these details.
Does it help for pores too?
Oh, absolutely. Tatiana
Pores?
knows.
Of
Go
course.
ahead, Tatiana.
Tatiana, you're on mute.
I mute myself. Definitely, it works very well on pores. And actually, it's something that you will see before the patient goes. When they comes with those pores very big, and then you do your treatment before the patient leave, you can see it. So those are amazing before and after picture. And today I did one patient. So and unfortunately, I do not have a front desk slash assistant with me this week, and I couldn't take pictures or videos. And I was like, oh my God, I missed this opportunity. And the patient so kindly say, I take a picture, don't worry, I send it to you. So yes, it definitely helps. And with the scar, I would like to add something very, very important. So I do have one patient that I have a scar from since she was little in the cheek. So I start treating with the green peas, and that's why Dr. Aras mentioned to you that you need to get the training with them. So, and I was a little more adventurous, and I went and used the red piece. Okay, so and I feel as soon I put it, the potence of this hand piece, I was like, oh, no, 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 too soon to use it.
That's why we say don't use it yet, right?
Yes, definitely no. But it's like if you are fast and awkward, you don't need too many passes. You don't need too much time.
Yeah, it's going to be very quick. So we have a question about Sandra asked about her client with lupus, and she wants to do the blepharoplasty. So I suggest to use the white handpiece and cat resurfacing technique for the first session. So in this case, you're 100% safe, you see good results. And then for the second session, with knowing more about her skin and her reaction, you can move to the plexroplasty technique and ablative technique. How do I treat blackheads on nose? Tatiana, go ahead.
On mute. You're on mute.
So with this one right here is my powerful tool to use and comes and get those head out from the nose. It's a little painful, but it works. So I don't do extractions, okay? My esthetician does the extraction, but sometimes I can help. If I see a blackhead, I go with this and I remove it.
Easy peasy. The other thing that we have with nose, which is especially it happens for, we call it nose contouring. So either if it is coming from neuroflema or from rosacea or just aging, which grows the basically nose size, you can use cat resurfacing technique or ablative technique. When you do that, you also take care of all the blackheads and all of that. How deep it can penetrate. The depth of penetration with Plexr is different. So you can be as deep as you want. That is not a problem. The thing is how superficial you can be. So with Plexr, you have this option to be very, very superficial on basically epithelium layer of epidermis. And also you can adjust your power to go very deep. For example, when you're working on keloids, like you remove a keloid, which is 1 centimeters in one session. So that shows how deep you can go, you know? And also you can be very superficial. As you know, we work on ocular surface with Plexr. We remove pterygium, pinguecula, conjunctival nevus using Plexr.
So we
Okay.
finished with the Q&A. There's a bunch of comments. If you have questions, please use the Q&A chat, but there are still some comments. Can it help with razor bumps?
Ooh, yes, no problem.
Well, there you go.
Yeah, you can remove them. You can remove them, you can resurface them, ablate them, very easy.
Does it help with marking from Grace?
With marking, the answer is yes. I don't know exactly what you mean by marking,
Yeah.
but if there is any benign lesion on your skin coming from any kind of tissue, for example, we have xanthelasma, which is the accumulation of fat tissue, you remove them. Like we have skin tag, which is the benign growth of your skin. You have all kind of benign molds and nevus. We can remove all of them. We have milia, we have hyperkeratosis, so any kind of skin growth which is benign, we can remove them. Also, if you're talking about tattoo removal or pigmentations who are deep like tattoo, we can also remove them, but there are different techniques. So for example, for tattoo, we have one technique. For melasma, we have another technique. Yeah.
Yeah, and it sounds like Colette's asking about the product we're talking about to treat melasma. We're talking about the Plexr, but perhaps you meant what protocol we're using to treat melasma.
The protocol we use to treat melasma, my favorite protocol is to use Plexr shower and the H1 serum, which we developed for basically melasma. Somebody asked about the serum. The serum is H1 serum, which is designed for basically melasma treatment and also any kind of pigmentation. It also has rejuvenative effect, and you can use it with Plexr shower. And then you send them home with one vial. So they use it between 2 treatments.
Thank you guys for having me tonight in this so interesting topic. And we cover even more than acne, and that's what I like. So you see that one just topic, it cannot be taught in one session. We had to talk about all of them because it's so versatile. And I encourage you to try new modalities. And I'm more than welcome if you are in the Florida area and if you want to try it on yourself, or if you want to just get the machine and get some training with me, I'm more than welcome to host you here.